Everyone in this room understands the deep connection between clean water, sanitation, and wellness. Hand washing and hygiene are easier with regular access to clean water in our homes. Health research tells us the lack of access to clean water can increase respiratory and skin infections. In this next section, we'll hear from the team at ANTHC who are committed to addressing water insecurity in rural communities. As I invite the team forward, I'd ask David to get us started. During the height of COVID, it was so frustrating to hear all the prevention advice of wash your hands, it's the best way to prevent COVID. And here our family in our villages, don't often have access to running water. And I'm proud to say, at least in the next decade, we might be able to fix that. So thank you, David, and your team for all your hard work towards water and sanitation.
Thank you very much, Natasha. And good morning, and thanks to everybody for being here today, either in person or virtually. So we're going to start with a quick introduction. I'm David Beveridge. I've had the pleasure of working here at ANTHC for 24 years. My current role is Vice President of Environmental Health and Engineering. So when I started here in 2001, ANTHC was relatively a new organization. The big priority then for us in DHE was transitioning statewide sanitation and environmental health services from the Indian Health Service. We were very early on in our self-governance journey. But before I jump in, we'll try to get through our presentation and then we'll take questions at the end. So people in healthcare and in the federal government, we use a lot of acronyms. As a division that began under the federal government, we also use a lot of acronyms. So I'll do my best today to call things what they are and define the ones that we use the most. So I'll start with the big one. So I lead the Division of Environmental Health and Engineering, which we call DHE. So our team is a prevention arm of ANTHC that works closely with the tribal organizations, communities, and the state of Alaska. Our work directly supports healthy homes and communities. As Natasha shared, access to clean, safe water is important. Hospitalization rates for infants with respiratory syncytial virus and lower respiratory infections in villages with less than 10% of the homes with water service is 5 times the national average of those homes in the rest of the United States with water service. And with pneumonia, it's 11 times the national average. So one of the things that brings a lot of joy to our work in DHE is the ability to see water and sewer come into homes for the first time. And so I've had lots of opportunities to travel to communities when we've completed this type of work. And in 2011, I was able to travel to Pickett's Point to celebrate that new system. And I was in a house with an elder, and he said, I used to run for my water, now the water runs to me. And I thought, wow, what a great way to say that. A few years later, Carissa and I had gone into a village in southwest Alaska that we had completed services to about a year before that. And we went into a house to talk to a mom who was there to see how things were going after a year. And it was interesting because that one day her daughter was home from school. And she made a comment that her daughter really hasn't been home from school sick in a very long time, and that over a year ago, she was constantly in the clinics and even in the hospital. So we made that connection. It was about that time that we actually hooked up the house to water and sewer, that her child was then healthy. And so she was able to stay in school more, except for that one day. But that's the type of things that really, that we're working on to eliminate that disparity, and we really work with communities to address that health disparity. So as we jump in, the division looks significantly different than it did when we first started 20 years ago. So we have, self-governance has provided us lots of opportunities to develop flexibility in the services that we provide all across Alaska. So I'm going to start by sharing a few of the exciting programs that our team has created over the years. First, the Alaska Rural Utility Collaborative. It manages, operates, and maintains water and sewer systems in rural Alaska. It started out as a pilot program with one of our tribal health organizations and now includes 30 communities statewide. If you hear people say ARUC, that's an abbreviation for that program. Well, back in 2010, energy was starting to go through the roof with the cost, and so we knew that that was going to put a lot of systems in a financial pinch. So we launched a rural energy program in response. The work that that program has done has saved communities millions of dollars over the course of the last 12 years. What started out as a team of 1 has now grown to a team of 13 people. We've talked a little bit this morning about the connections between health and the environment. Recognizing this link, ANTHC's launched several important efforts. So I'll go through a few of those. The Alaska Tribal Conference on Environmental Management, also known as ATCEM, is a yearly conference that we lead, and it brings together environmental professionals from across the state to learn from one another, to connect with support organizations and other agencies, and to discover the resources that are available. This year, we had over 500 people in attendance. Another important program, the Contaminated Sites Support Program, assists communities all across the state in managing the cleanup of contaminated soils and groundwaters in their communities. The Local Environmental Observer Program, the network, also called LEO, it's a collaboration of environmental observers and topic experts who apply traditional knowledge, Western science, and technology to learn more about our changing environment. And the statewide support for the Indian General Assistance Program, otherwise known as IGAP, we provide support to help develop and establish capacity to implement programs administered by the EPA. The statewide Emergency Preparedness Program provides assistance and builds up the emergency management capacity of the tribal health system. And more recently, one of the most exciting areas that we're growing is in climate initiatives. Our Climate Initiatives Program. This team coordinates climate-related initiatives at ANTHC. And we recently received a $74.9 million investment from the National Oceanic and Atmospheric Administration to expand on this work. And we're working with a lot of tribal partners across the state to complete that. So we are doing a lot of exciting work at DHE, but our focus today will be on the two critical areas, as Natasha mentioned, sanitation and sustainability. This is where the heart of the work that we do in partnership with rural Alaska Native communities. In the presentations ahead, we'll discuss some of the highlights from this past year, including where we're at now with the sanitation funding that we've received through the Infrastructure Investment and Jobs Act, which is also known as the IIJA, the successes that we've had to date and the path forward, including some of the challenges that we're experiencing right now and what we're trying to do to address those challenges and find solutions, and also how we're improving sustainability and addressing operational and maintenance issues. So we're going to jump in with Carissa Willier. She's going to start out with an overview of the IIJA. Thank you.
Good morning, everyone. I'm Carissa Willier, and my role with ANTHC is Sanitation Facilities Program Director. This month marks my 10th anniversary with ANTHC. Prior to working for ANTHC, I worked for the Indian Health Service in the Division of Sanitation Facilities Construction in Fort Duchesne, Utah, and Rockville, Maryland. One thing I want to mention right off the top, I'm happy to help and be a resource for you. My contact information is on the screen. Please reach out anytime you have an issue or a question. I also want to acknowledge that the funding, the engineering, and the construction side of the work that we do can be really complicated. The timelines can be frustrating. I'm going to do my best to help you make sense of a complex subject where the details really do matter. Please ask questions at the end if anything is unclear. Let's begin with the funding. This graphic, I know, is complex, and it shows the main funding sources for water and sanitation projects in Alaska Native communities. The first one is the State of Alaska Capital Improvement Project Program, which we refer to as CIP, the Indian Health Service Sanitation Deficiency System, which we refer to as SDS, and then the final one is the Indian Health Service Housing Priority System, which I call HPS. CIP is represented in dark blue on the left side of the graphic. The CIP program is administered by the State of Alaska in collaboration with the U.S. Department of Agriculture, Rural Development, and the U.S. Environmental Protection Agency. The projects selected for CIP funding receive 75% of their funding through the federal government, USDA, or the USDA Rural Alaska Village Grant, or the EPA Alaska Native Village Grant. The remaining 25% of each project's funding comes from the State of Alaska Village Safe Water Grant. The right side of the graphic in gray shows the funding allocation system for the Indian Health Service housing funding. One important note, IHS does not build housing, but this funding provides water and wastewater facilities for newly constructed or recently renovated Alaska Native homes. For HPS, the project costs are entered into the IHS Housing Priority System and funded in priority order according to the agency's funding criteria as well as the available funding. The middle part of the graphic in lighter blue shows the funding sources allocated through the IHS Sanitation Deficiency System, which is the focus of my presentation today. The main funding source for the IHS projects is their regular funding, the money that they get every year through the IHS annual budget. Sometimes IHS receives additional federal funding from Congress. A couple of recent examples are the American Rescue Plan, which we refer to as ARPA, and the Infrastructure Investment and Jobs Act, or IIJA, which I often call the infrastructure bill. You'll also see the non-IHS contributors to these projects, including the EPA tribal set-aside funding that comes through the Clean Water Act and the Safe Drinking Water Act, as well as the Denali Commission funding. These three systems allocate funding using objective scoring factors to rank projects for funding. Because the need for funding is greater than what is available, projects are funded in priority order based on the available funding. The scoring factors include the health impact of the project, the severity of the deficiency that's being addressed, the regional priority, and the capital cost per home for the project. Once projects are funded, they are managed by either ANTHC or the State of Alaska Village Safe Water Program in collaboration with the communities. David will talk about project delivery methods in a few minutes. While ANTHC is not a funder of projects, we support communities with project planning, applications for funding, design, and construction. Regardless of whether a community project is coordinated by ANTHC or the State of Alaska's Village Safe Water, all communities are eligible for the same funding opportunities. So now we'll get into the Infrastructure Investment and Jobs Act. Our critical work received a historic boost through the IIJA. The law provided $3.5 billion to the Indian Health Service Sanitation Facilities Construction Program. The intent was to provide full funding to Indian Health Service to address all projects listed on the nationwide SDS database. When Congress drafted the infrastructure bill, the entire database had a total project cost of $3.5 billion. One important note for this funding is that up to $2.2 billion of the total can be used for economically infeasible projects, which means the unit cost per home exceeds the maximum IHS cost per home. Why does this matter? In Alaska, the maximum cost per home for an IHS project to be considered economically feasible is about $200,000 on average. Before IIJA, IHS would not fund projects whose cost per home exceeded $200,000 unless another funding source was in place to bring the IHS portion within the maximum limit. This impacted our ability to obtain funding for first service projects. We are grateful to the Alaska delegation for their work to include sanitation funding for Alaska Native villages in the infrastructure bill, and to President Biden for signing it into law. This change is why so many people have called the infrastructure bill a once-in-a-generation opportunity. It really does mark the first time that IHS can fund first service projects in communities without piped water and sewer. The IIJA funding is being allocated over 5 years, $700 million per year from fiscal years 2022 through 2026. Each year, IHS allocates $675.5 million to approved projects. They use the same objective scoring criteria mentioned earlier and fund projects in priority order. $21 million per year is reserved for IHS salaries, and $3.5 million per year is reserved for the Inspector General to oversee the funding. During the first 3 years of the infrastructure bill, available funding covered almost all of the approved projects in Alaska. We recently completed the application cycle for the 4th year of the infrastructure bill. This year, project costs exceed the available funding. This means there will not be enough funding to cover all Alaska projects. We'll know which projects receive funding in the next couple of months. We're also working on the one remaining funding cycle under the infrastructure bill, which is fiscal year 2026. We are grateful for our tribal partners and those at EPA, Denali Commission, and USDA who continue to cover IIJA project costs that the IHS deems ineligible for the IHS funding. I mentioned earlier that Congress used the total cost of all projects that were in the IHS SDS system when they drafted the IIJA. That's where they got the $3.5 billion figure. IHS realized early in the implementation of the infrastructure bill that the funding would not be enough to build all projects in the SDS database. With this in mind, IHS restricted eligibility for infrastructure bill funding to projects that were in the database as of November 2021, which was the month the bill was signed into law. This list of projects became known as the Legacy List. Almost all first service water and sewer projects in Alaska are on the Legacy List. This map shows the more than 360 Alaska projects that are on the Legacy List. Of the $3.5 billion on the Legacy List, $1.9 billion is in Alaska alone. The colors represent each community's level of service for water and sewer. Red dots represent communities that don't have piped water and sewer. This is what we call unserved. In these areas, people have to self-haul water and human waste. 45% of the Alaska Legacy List projects are in these communities. The yellow dots are communities with either closed haul water and sewer or where at least 20% of the homes are still not connected to the piped water and sewer systems. We call this category underserved. Almost 30% of the Legacy List projects are in these communities. Green dots are communities with piped water and sewer. Projects in these communities are to address aging infrastructure that requires replacement or rehabilitation. We have copies of the Legacy List, including the current project status, at our booth if you want to pick one up. For a water and sanitation project to get federal money, it must meet the IHS standard of ready to fund. This does not guarantee funding. Instead, ready to fund essentially means a project is ready to compete for available funding. The big hurdle to meet this criteria is completing a preliminary engineering report, which includes describing the sanitation deficiency, evaluating the solutions to address the deficiency, and selecting the preferred solution, and then developing the scope of design and construction along with a cost estimate. Once all of that is ready, we're ready to apply for the funding. Community engagement is critical when evaluating project options. Communities make important decisions to select the project that is right for them. ANTHC works closely with the community at every stage of a project, including development of the preliminary engineering report, design of the project, permitting, and construction. Due to the complexity of first service projects, planning takes a lot of time and work. This planning effort has been a top priority for communities, health organizations, engineers, technical reviewers, and funders. The first service projects score the highest on all of the objective scoring criteria because they address the most severe deficiency, lack of running water and flushing toilets. We're grateful that IHS provided $13 million in 2021 to support completion of the first service preliminary engineering reports. This map highlights the 34 first service Alaska projects that are on the legacy list. 15 first service projects have been funded through the first 3 years of the infrastructure bill. They're highlighted by the green font. 19 first service projects, noted in orange and blue font, are still seeking funding for their first service projects. Almost all projects listed in orange earned IHS Ready to Fund approval for FY25, but there's not sufficient funding to cover all of the project costs. So not all of the projects will receive FY25 funding. We will know that in a couple of months, which projects get funded. The projects listed in blue font will seek IHS Ready to Fund approval for fiscal year 2026 infrastructure bill funding. I mentioned earlier that projects are managed with the community, either by ANTHC or the State of Alaska's Village Safe Water program. Here's what that looks like in practice. The lead agency works primarily with the utility owner to implement the projects. In communities where the utility is city-owned, tribal approval of the project agreement is required for IHS funding. ANTHC receives the IHS funding and reimburses the state of Alaska as the IHS-funded projects led by the state Village Safe Water program are completed. This chart shows the breakdown between ANTHC-led and state-led legacy list projects and ANTHC's estimate of how many legacy list projects could receive funding through the infrastructure bill. Columns A and B show the total value of projects in the legacy list, one snapshot as of November 2021, and then 3 years later in 2024, after the project costs had been updated. In 2021, the total project cost was $1.9 billion. As the preliminary engineering reports were completed, cost estimates were refined. The revised total cost estimate of projects is now $2.99 billion. This leaves a projected funding shortfall of $1 billion for Alaska's legacy list projects. Column C shows our projections for the total costs of projects we expect to be funded by the infrastructure bill. Actual funding amounts will depend on how IHS allocates the last 2 years of the funding. In column D, you can see that $2.2 billion of the $2.6 billion in potential infrastructure bill funding would be for first service projects. I want to mention that it is possible that IHS may cap the infrastructure bill funding allocated to Alaska. Another thing we're watching is how inflation is impacting project costs, and we have seen increases well beyond the original 2021 legacy list. If resources are ultimately strained too significantly, ANTHC will continue to work with the communities on advocacy efforts with the funders and the Alaska delegation to fully fund the legacy list projects. What we're seeing with the cost estimates exceeding the available funding is not just in Alaska. It's also a significant problem nationally. There are shortfalls between the available infrastructure bill funding and the current cost estimates everywhere in the country. This slide is from an Indian Health Service presentation in June. It demonstrates that the $3.5 billion from the infrastructure bill is not enough to fully fund the entire legacy list. And it likely means more money will be needed to provide first service in every Alaska Native community. IHS recently closed the FY25 funding cycle. We'll share the results as soon as we have them and let everyone know what it means for the Alaska projects. As of August, ANTHC has helped secure $1.25 billion in funding for water and sanitation projects in Alaska during the first 3 years of the infrastructure bill. Based on estimated cost estimates, we anticipate to fully fund the remaining legacy list projects. A total of about $1.7 billion will be needed, including $1.4 billion to fully fund the remaining first service projects. That brings me to the focus for the next year. Priority number 1 is securing additional funding from the infrastructure bill. But we're also working on the engineering, design, and construction for projects that are already funded. I hope this overview is helpful. Please find me afterwards if you have any questions. And again, use me as a resource and contact me anytime. Let's welcome David back to continue his presentation on our work.
Thank you, Carissa. I appreciate that. It's a lot of information. I know that. In your bags and your packages there is a copy of the PowerPoint demonstration, the PowerPoint presentation. So you can pull out afterwards if you'd like as well. So I want to reiterate a point that Carissa had made and emphasize just how significant the IIJA funding has been, even if some of the challenges we experience go along with it. So the graph that you see now shows the historic water and sanitation funding levels and amounts and some of the projections. The big takeaway is how much more funding we're receiving as a result of the IIJA than we normally would. Once IIJA is out the door, we do expect funders will revert back to the past funding levels with maybe some slight increases to make up for the growing costs. But ANTHC is facing the same similar challenges as other tribal health organizations and other organizations around the country are experiencing, and that's staffing. We just cannot hire immediately all the staff that we need to do to support this historic amount of increase in funding. Nationally, there's a shortage of experienced engineers. This adds to the challenge of growing our staff as well. One bright spot that we've seen is we've been successful at hiring entry-level engineers, but they need supervisors that are experienced in Arctic sanitation and the engineering in this environment. So we can't have junior engineers complete work without that type of high level of experience. And those engineers are hard to come by. So a lot of questions that we get are about the timelines, and that makes a lot of sense. People have been waiting a very long time for these investments, and most just want to know when this work will finally happen in their community. So I want to jump in and make sure that everyone knows what this process looks like. So the slide here shows what the general timeline is for a typical very large project that provides first service water and sewer. So first service projects can take anywhere between 6 to 8 years from the time that the funding is received until the construction is actually completed and water is coming out of the faucets. Once a project is funded and we have an agreement in place with the community, then the design and pre-construction activities typically begin, and these can take 1 to 2 years. And this time is needed to allow for things like the geotechnical work that's needed, all the land surveying, getting all the permits and environmental clearances that are necessary from the government agencies and the state agencies. It also includes obtaining site control, which is absolutely essential to construct the facilities. And working through projects that cross the BIA restricted lots often adds a lot of time to the projects. And that's even when the realty functions have been assumed by the tribe. So depending on the complexity of a water and sewer project, the construction phase itself can take 3 to 6 years. And this includes the logistical and all the engineering considerations when working in rural Alaska. We have a shortened construction seasons. Some projects require frozen ground to construct and move equipment. Many projects are in areas that are depending on the river water levels to deliver equipment and materials, and those water levels are often undependable. So providing piped water systems requires special planning in many different ways. So one thing is we need to provide access to a quantity and a quality of water that meets the community's needs long into the future. Current systems without piped water don't require that much water in homes, in communities with washateria. So when we go to put in a piped water system, the whole system needs to be upgraded. And that means finding the right water source, getting the proper design treatment, and plans for treating and disposing all the extra sewage that's generated with the community piped system. Also, additional energy is often needed to keep this system running. And communities have issues with those power systems, and so we need to address those issues before we launch one of these large projects. We also need to complete home surveys in all the homes in these first served communities to plan for inside bathrooms and kitchen facilities. Many homes have very, very tight spaces that we need to work in. And all the work needs to be done in compliance with the regulations and all the codes. And that includes plumbing and electrical work that needs to be completed by licensed plumbers and electricians. So we are always working on creative ways to complete the work, because our next challenge will be successfully and efficiently delivering these projects on a scale that we've never experienced. And this includes reducing those timeframes to complete the projects. And we do that by breaking the projects down into smaller scopes so we can start construction earlier. You'll see on this next slide is our project delivery plan. So in DHE, we face two fundamental pressures when it comes to water and wastewater. One is delivering results for a massive number of projects and meeting the needs of the communities with systems that will last for generations. So as you can see here, going into this last fiscal year 24, we only plan to spend $14 million of the IIJ related projects. And that's because we had over $200 million in projects that we were already working on. So much of the work was well underway when the IIJ funding was awarded. And we couldn't just divert staff and resources to immediately work on the IIJ work. We also maxed out almost the entire engineering community in Alaska with this work that we're doing. So this past year, we delivered about $140 million of projects and programs. It was a record year for us. That only included $13 million of the IIJ work, but we were able to address a large amount of the project backlog that we had. It was nearly a 19% increase in delivery of services with only a 7% increase of staffing. So as we've navigated managing this transformational amount of sanitation projects, we've developed this project delivery plan for the next decade. And that includes scaling up capacity through multiple areas. That's increasing our in-house teams to carry out about a third of this work. We're increasing our contracting and subawarding to communities and tribal health organizations. We're hiring additional engineering companies with national offices as term contractors. Right now we have 6 engineering companies that are on term contracts. Several have national offices. We're also growing our contract delivery team in anticipation of this increased work, as managing construction contracts requires specialized experience. And we're partnering with the state of Alaska Village Safe Water Program, as they will receive a large portion of the funding that they're responsible for, and that is in the gray on this chart. So overall, this approach is going to help us to deliver projects and hit our targets. But even with this framework, we're going to be challenged by workforce and labor challenges as we compete with other statewide infrastructure projects and limited resources. So when it comes to delivering these projects, there's basically 3 different methods. And related to these challenges, and I'm going to talk about the 3 methods and the challenges that we have and what we're going to do to address those. So the first is our force account methods. And force account is what most communities prefer. It provides on-the-job training. It maximizes local employment in the community. It keeps wages in the community and provides a sense of ownership for the facilities. In force account, ANTHC provides the engineering support, the construction management, a superintendent, and provides support for the trades. The community provides local labor with both people with experience and those that need additional training. Another benefit of developing this local is the development of local knowledge of how the system was constructed and how it operates. And for long-term sustainability, this is invaluable. The second delivery method is contracting. And historically, we've limited contracting to just special parts of a project, like maybe installing a lagoon liner in a wastewater project or a new water tank where we don't have that specialization. But now we're looking at contracting projects as a whole. But to try and maximize the local hire, we've been including local hire incentives in the contracts. A typical way to contract historically has been to design the entire project, put the project out to bid, and award to the low bidder. And that's not always successful. And for these large first service projects, it could provide a significant delay in the completion, especially with how long it will take to complete the design of the whole project. So construction manager at risk and design build are two new contracting methods that we're using to reduce this time. And this allows contractors to get to work on elements that have already been designed while the rest of the design is being completed. But we've encountered challenges in our contracting in the past, and primarily in this past year, it's really included the work that the contractors are doing in homes and the inspections of that work. And so we're looking to improve that this coming year, and limiting the work that the contractors are doing to outside of work while ANTHC completes and trains local hires on carpentry, electrical, and plumbing for the inside work. So a third delivery method is through community or tribal health organizations or THO subawards. So many communities have carried out projects in the past, federal projects, and welcome the opportunity to complete this work. But we're happy to create templates and agreements for this type of award. And to move forward, if a community or THO is interested in doing this work, then you would complete a request with our project managers, a request form, and then we will do our due diligence reviewing that and performing that capacity assessment. And if awarded, then the subrecipient will enter into agreement with us to carry out the work, and that defines the requirements of the work, the standards, and the scope of the project. And we can provide some limited technical assistance to subrecipients to successfully administer their projects. But there are some important details on that. One is communities that would opt for this, it could trigger the need for a single audit, a federal single audit, which can be very challenging if an organization hasn't had one done before. And another point that I like to make is that the IIJA provides millions of dollars for the Office of Inspector General to oversee expenditures. Carissa mentioned that. It's over $3 million a year or 5 years. That's over $15 million. And their focus is on compliance with all applicable federal regulations. So we've already met twice with the Office of Inspector General since the IIJA. And most recently, we sat down with 3 special agents from their Office of Investigations to discuss their oversight responsibilities. So with 2/3 of the money coming to Alaska, all eyes are on us to make sure that everything is going to be done correctly. So we absolutely want to make sure that the work that we do through any of these delivery methods meets all the federal requirements so that we don't put ANTHC, a community, a THO, or any of the federal funding streams at risk. So once these new systems are finally constructed, it's going to be equally important to keep them running smoothly. So I'm going to turn it over to Francine Moreno, who's going to talk about the work that we're doing in this area. Thank you.
Good morning. My name is Francine Moreno, and I am the Director of Rural Utility Management Services, also known as DRUMS. I've been with ANTHC for 19 years. My family is from Alukkanuk, and I am so honored to do the work that we're doing together to ensure our friends and family throughout rural Alaska have access to water and wastewater. My contact information is available on the screen. Access to clean water is our mission. Without it, we know community health suffers. While we support project implementation, communities are the utility owners responsible for successful operations and maintenance. This should be planned for and discussed before a project, but it does not mean that rural utility owners are doing this important work alone. Each community is unique, they require different systems, and varying operations and maintenance, or O&M costs, translating to varying user rates. Each community chooses the system that fits their needs, the O&M costs, and final user rates as part of the preliminary engineering report process. First service utility costs and user rates are projected to be high. ANTHC and our tribal partners have taken a proactive approach to addressing high utility costs. We developed the Sustainable Tribal Operations and Maintenance Demonstration Program proposal. This proposal is going through its final review period and requests $20 million in funding to facilitate an operations and maintenance funding program in Alaska for 2 years. The goal is to collect utility data and information to demonstrate how and why providing this funding to utility owners offsets the high costs in Alaska. This ensures reliable and affordable service, improves utility management, and extends the life of the infrastructure. Another service ANTHC provides is capacity building and opportunities to ensure healthy homes and communities long after the infrastructure is delivered. Each household throughout rural Alaska has the right to safe, sustainable, and affordable water and sanitation services. Developing local capacity is essential to sustaining water and wastewater infrastructure. Through self-governance, we are committed to providing programs and services for communities to develop technical, managerial, and financial capacity. Each of these programs have staff here in the room today. Please stand when I call your name, or raise your hand. Chris Cox with ARUC. Dustin Madden with Rural Energy. Brian McGeaney with Tribal Utility Support. They are more than happy to answer your community-specific questions. As communities experience challenges with systems, each of these programs are available to support utility owners and operators. For operators, if technical or emergency support is needed, remote maintenance workers are typically the first point of contact for support. If additional support is necessary, ANTHC's Tribal Utility Support Team is available. ANTHC operates the Alaska Rural Utility Collaborative, or ARUC, a voluntary program that partners with communities to support and empower community efforts in managing, operating, and maintaining their water and wastewater infrastructure. Right now, we have 27 member communities that build local capacity and lead the ARUC program. Each community's elected advisory members provide programmatic direction and goals during committee meetings. Member communities also build capacity through its operator exchange program. This enables operators from one community to travel to another to provide projects, training, receive technical and emergency support, share creative collection efforts, establish sustainable budgets, rates, and build emergency reserve accounts. Most of my career at ANTHC has been with the ARUC program. I can tell you firsthand, each community representative not only wears 10 hats, but they do so with much enthusiasm because they know what is best and they are the voice for their community. They are the ones who built the program into what we see today. We look forward to the program's further success as ARUC adds 30 additional member communities over the next 10 years. First service communities will be offered membership as a priority, and existing member communities are excited to share their operations and maintenance knowledge with others receiving new infrastructure. Another newer initiative arose out of the need for virtual training during COVID restrictions. Since our first small systems training in 2020 with the Norton Sound Health Corporation, we've developed 5 additional training curricula. Pass rates for the level 1 water treatment training averaged about 76%. Prior to this virtual training program, Alaska's level 1 certification pass rate was 5 to 7%. In FY24, the Tribal Water Center hosted 8 free trainings and reached 144 students from 75 communities. The pass rate for all trainings this past year reached 82%. Operators take nationwide exams. They must learn about systems and math that they'd likely never use again unless they move to the lower 48. So this training is effective in its schedule for about 2 hours per day for 2 to 4 weeks, while also providing local support as they take their proctored exam within their community. From personal experience in attending the program's first training offering, not only does the training meet you where you're at and not burn you out while learning the content and concepts are often translated into our traditional practices. As a non-technical, non-engineer attendee, I could understand and grasp the concepts. I learned from and networked with other operators and passed the small treated certification exam. For operators, they have tough and important jobs. They ensure that we have access to water, wastewater, and sanitation for generations to come. I'd like to extend my gratitude to each of them for their passionate dedication. Utilities in rural Alaska are expensive, and sanitation systems are particularly expensive to operate. Communities typically have high diesel fuel and electricity costs. On average, about 40% of the sanitation system's operating budget that establishes user rates. This provides an opportunity to find savings. Our Rural Energy Program, created in 2011, helps communities implement energy-related infrastructure to reduce energy costs. These range from energy efficiency measures to large-scale renewable solutions such as biomass, wind turbines, hydro, and solar. Currently, we are working on a community-scale renewable energy project that will allow the city or tribe to construct and own power generating facilities that produce electricity. This electricity will then be sold to the power company. The money generated from these sales will be used to reduce the cost of water and wastewater utility bills, increasing affordability. A reminder that this is a health issue. Not having access to water and wastewater within a home increases skin and respiratory infections. In Alaska, there are concerns that both new and existing systems will not be sustained or affordable. ANTHC, through self-governance and self-determination, is dedicated to facilitating programs that support communities with operations and maintenance to build local capacity, improve affordability, and ensure sustainability for generations to come. Feel free to find me or any of our program staff afterwards if you have any community-specific questions about the programs I covered this morning. Guyana will now transition back to David.
Well, thank you, Francine. There's so much good stuff. I wish you could just keep talking about it. There's a lot of progress in the area of sustainability that we're quite happy to be engaged in with the tribal partners. So, you know, one of the things when we have such a large footprint across the state with all of our programs and our projects, we're actively working to improve communication with the public and the communities. And we've tried several methods of communication. One of the things that we thought was the best were emails that were sent out monthly by Carissa's project managers to community representatives on the status of projects. But that hasn't even shown to be effective. So we are working on creating a public website that anybody can access that portal. And it'd be very similar to what the Denali Commission has with their project website as well. But at the same time, ANTHC is performing a major board-approved upgrade to our entire finance system. And so when completed, our intention is that that new financial system will connect to this public-facing website to give you real accurate live information on the projects. But meanwhile, still the best communication is on your projects is through your project managers and program managers. So we also have a survey that we'd like to gather feedback on how we're doing in your community. On the screen, there's a QR code. You could snap that with your phone. We're going to have these cards at our table out front as well. It's got the QR code. And if you go to that, it'll ask you your community information, your role in the community, and then how we're doing on our projects, and ask us to put a rating on there as well. And we want to look at that. And so we really appreciate honest feedback on that. It'll help us do better in the future. So again, our team is here today. We have folks in the back. We have folks in our booth out here. If you want to meet individually with a project manager or a program manager, as mentioned earlier, you can go to the registration table and ask, and they can connect us to the right people. And so we do have a location downstairs. It's in the Cafe Promenade until 11. There's an area of tables out there to meet and talk about your projects. And then after 11, the whole cafeteria down there will be opened up for ANTHC meetings, not just with the project management, but with the EHR as well. So with that, I wanted to open it up to questions. So I know this is a lot of material. It is a lot of material. Again, the presentations are in your packet. You can take back. What we'll do is we'll try to answer questions. There's a mic to come around. We'll share an answering here with the team if there's a specific question. If it's a specific project question, we might not know the answer to that specific project, the three of us, but we'll try to help connect you with the right people, and we'll try to answer that in general if we can as well. So with that, I just wanted to open it up to questions. If somebody...
Good morning, David. We have some questions.
And I believe if you're online, you can drop a question in the chat box, and our team will be able to raise that question. There's a question over here.
We're going to go with a question online, and then we'll run a mic over here onto the right. Are you guys helping out with scholarships for vocational education and colleges for students to become engineers and licensed in the trades you all need?
All right. So specifically within DHE, we do not offer the scholarships within DHE, but there are scholarships that ANTHC offers, and so I believe there's information for that that is out in the public, and it might be better to get a different person to answer the question of how that can be accessed. But the one thing that we do is we have a really robust internship program, and so I'll talk about that just for a second. So we've had, I think last year, 11 or 12 interns, and so we really try to open that up to Alaska Native intern applicants first and foremost. If we can't fill all of our needs with Alaska Native interns, then we'll expand that to be able to help us complete the work. But again, this year we're looking at hiring, bringing on at least 12 interns, and we work closely with the ANTHC program at the University of Alaska here in Anchorage, and we have a lot of engineers within DHE right now that came through the ANTHC program, have been scholarshiped in other ways, and interned with us, and have since come back to work with us full time. So as far as scholarships for those opportunities, we do not have that in DHE. There is, we do have Jenny Harrison here today too, and she'll be out at our booth, and she could talk to anybody about opportunities in the workforce development that she's been investigating, and opportunities for funding those types of opportunities as well. So thank you. I saw a question over here.
Peter Earl Williams, Arctic Slope Native Association, and the Tribal Council representative. I just want to address something to you that the reason why these people are clapping for you, they're encouraging you to step up for our plate. Last 24 years, I've been sitting on a toilet, summertime. In wintertime, I sit on a honey bucket. Our septic tanks are on surface. And the smell down the street, and these kids are getting on a bus smell it. And that needs some encouragement to stand up for our people for a health reason. Plus, that you should put behavioral health on top of this list because you never hear much about behavioral lists. Behavioral is something that deals with health problems, sickness, and we need that on a plate. Another thing is that all these people that are standing here being represented, they come from each villages. Are each village allocated to their funds? Because, when you're going to capital to see how much you get into your tribe, they should be getting funds for each village, not just certain places. Thank you.
Thank you. I'm going to let Carissa respond. Thank you.
So I want to thank you for the comment and encourage you afterwards to meet with us and talk about the specifics of what you're describing. As far as distributing the funding, we are following all of the Indian Health Service requirements, and so there actually isn't a way to distribute the project funding based on population or community needs. We have to follow the existing IHS guidelines that are followed across the nation. And so I think, as much as possible, we definitely are embracing self-governance and self-determination, but with all of the oversight, we are stuck with some of the federal regulations, and that's important to Congress who's allocating this money. So, but I would like to talk to you afterwards and talk about the specific issue, because I think we do have a lot of different programs, and the issue you're experiencing in your village, likely we could get it onto a path to address it.
Thank you, Carissa, and thank you for that.
For the question of the scholarship opportunities, the ANTHC Board of Directors directs 10 $5,000 scholarships annually. That will open up usually in the spring around March, and that is it is advertised on social media. For the individual online that asked the question, if you could please share your contact information in the chat, we will also follow up with you with those details. And also from online, we have another question. So with global warming and climate change getting worse year after year, what are your plans to keep existing infrastructure sustainable and operating?
Thank you for that question. That is definitely a challenge. We are, as I mentioned earlier, one of the initiatives that we've launched this past year is our Climate Initiatives program to bring together all the different aspects of working on these very difficult questions that communities, and the situations that communities are facing. So I believe that there's 144 threatened communities right now in Alaska, between either threatened by permafrost degradation, flooding, or erosion. And so each community basically needs to come to decision-making within those communities of how to address those situations. And so that's one of the things that our Climate Initiatives program is working on with this funding that we got from NOAA. It's going to empower communities to have the information to make decisions. So part of that's going to be performing risk assessments in each community. Those risk assessments will help inform communities on the timelines that they have and what they need to be considering. And then a lot of communities need assistance with helping to navigate what the next steps are, and that's where our climate adaptation program comes into play, and our team can work with the community and within the regional resources to help chart a course. So when it comes to infrastructure, one thing is we get asked that a lot with even these first service project. If a community may relocate, why would there be investment there? But communities have been facing these issues for a long time, and there's been some communities that have been, they didn't get the resources from the federal government that they should have received, 20 years ago, because that discussion was even on the table. And so because we know that communities will remain where they're at or make their decisions if they want to relocate, we need to move forward with these projects and listen to what the communities are saying. So the planning that Chris and her team is doing is engaging communities with these tough subjects and having them tell us what they want to do, what their plans are. And so our team's gonna, when we come to designing things, we need to make the designs able to meet the forces of nature that the community is going to experience. And that could be, in some cases, making things that are portable that we could move to another location if necessary, structuring and firming things up, raising things to certain elevations. So each community is going to have a very specific design, and that's one of the reasons when I said earlier that the designs can take 1 or 2 years is because it's not cookie cutter. Every community is very different, and how they're addressing these environmental challenges is very different. Thank you for that question. Yes.
Yes, good morning. My name is James Landlord. I'm from Mount Newlitz. I represent our tribe. We're in the process of constructing homes, two duplexes and a BIA home. All the foundations the gravel foundations are laid out. ABAC poles are in their place. And the material for the housing came in this fall. At the same time, we asked IHS that we need water and sewer hookup for the new homes. But one of our consultants read in IHS policy that there would be no water and sewer hookup until the new homes are occupied. And we thought that wasn't right, so we think that the new homes and water and sewer should be done at about the same time. So we passed a resolution to NCAI in October to asking IHS to look at their policy that there will be no sanitation until the homes are occupied. So the resolution was sent out to IHS through NCAI. That's a comment I wanted to make.
Thank you. I'm going to let Carissa talk a little bit about some of those policy challenges that we have with housing.
Thank you. I appreciate that comment and that the tribe was, put the resolution together and submitted it. I'd like to talk to you afterwards about the specifics because over the past couple of years, that issue has come up as far as the policy being that IHS refuses to fund future need. And so there's a couple ways to look at that. And we've worked really closely with the Alaska Area Indian Health Service Office so that when a home is being built with BIA funding or tribal funding, we are able to get a letter from the builder that describes the timeline and what funding sources are committed to building the house. And with that, we're able to stay within the Indian Health Service funding criteria of we can't fund future need by saying we do have a commitment to build this home. Here's the schedule for when it will be built. And like you said, get the water and sewer funding in place so that when they move into the new house, the water and sewer follows quickly after. And so the critical piece there is having a letter that describes the funding source for the house, as well as the timeline, the expected timeline of when the materials will arrive and when the house will be built and occupied. Because with that, once we have that official letter, the Indian Health Service Alaska Area Office has been very supportive of us submitting that as a current need, you know, realizing the house might not be occupied yet, but it's really coming, it's going to happen, and so why would we wait to then seek the water and sewer funding? So I'm glad that you wrote that resolution that further supports what we've been working on, and then I'd like to talk to you afterwards about the specifics. Thank you.
Thank you.
Good morning. My name is Mary Willis. I'm the trouble admin from Village of Stony River. I just out of curiosity, I have a question about maybe the scattered sites and other things. In 2018, we had a few households that had applied, and it's been since 2018, but it's been constantly pushed back for one thing for another. One of the things is getting the native allotment. You know, these days, like when parents, you know, pass on, and then with the native allotments, you have to get, you know, some type of approval, and then there's 6 different people owning that, you know, so that you can't get that approval. Then how can we move forward with, you know, and then it's just sitting at the back of ANTHC's desk with, you know, waiting and waiting and waiting. Pretty soon, you know, this has been since 2018. Then we couldn't do anything with the pandemic. Now that it's been over, I've been kind of bugging ANTHC, you know, for getting these projects started, but, you know, nothing yet. Then the other thing I have, just a comment that I have, it's like, well, why with this water and sewer program that's going on that, you know, billions of dollars, why is ANTHC funding villages that have no residents year-round, but just a handful, and doing 10 households with water and sewer? Then the next village or 2 villages over, they're refusing to do anything, but says, well, fill out your applications, and your house has to be fully ready, or your bathroom. But how can we help those people that don't have the funds to, you know, have the bathroom all ready, and you guys just come in and plumb it? Or so that's kind of where we're stuck at, and it's kind of frustrating to go around and round and round, you know.
Well,
thank you.
Thank you. I can imagine that's very frustrating, and so I will take back that information. I was not familiar with the situation with multiple owners after somebody had deceased, so that's something that maybe we could possibly work through with IHS on their rules. So this was those funds that access that program are the ones that were on that far right bucket, housing support funds, and they have a lot of specific requirements to those, unlike some of the other funding that we get. So I will we'll work with our team to see if there's a way to get some kind of documentation that could allow us to move forward with that project. So sometimes we do hear a lot of comments on our scattered sites program. Tomorrow at the BIA Providers Conference at 1 o'clock, there is going to be a session strictly on this program as well. So it'd be another place to get some more information on it. But as far as I think one of the challenges that we have on these situations of building and getting water and sewer into individual homes is, of course, the eligibility and then the timing. So with that particular funding, we have to put names on a list and try and get money from IHS, and then we get that funding the next year later, then we start that design. So it's already a long period of time, but 2018 is way too long. So I'll look into that specific situation there. Maybe we could connect afterwards. But is there anything you wanted to add, Carissa, on this too?
I just want to say hi to Mary. And then I do want to add, you know, David mentioned during the presentation about complying with the various regulations. So those are federal funding rules. They're also the state of Alaska kind of regulatory rules around having, for in this situation, on-site wastewater disposal. And so the funding agency requires proof of ownership of the land and the house, which, like Mary mentioned, that can be really frustrating if the applicant passes away and now the ownership has transferred. And so that it's very hard for us to see it too. And so I think, like David said, 2018, that's too long. But I just want to mention that it's a lot of these regulations that ANTHC is, as much as we are embracing self-governance, we do still have to follow the rules. And so for on-site wastewater, one of the rules is to apply to the state and have the system that's designed approved by the state, because they have to protect the groundwater. And so that's where we need somebody to sign who has authority over the property. But it is really frustrating, and that project in particular reminds me of a colleague who left ANTHC because of how frustrating things like that were. And we all really resent how much the red tape gets in the way of really accomplishing this work. And now I forgot the second part of your question, but I'll catch up with you after. Thank you.
Thank you.
Thank you. Good morning. Thank you for allowing me to ask a question. Jacqueline Bergstrom, the Health Director for Tanana Chiefs. And you are all very, very aware that many of the unserved and underserved communities are in the interior. Very complex. And so water and sanitation needs is one of the top things that we hear every time we're in conversations with our communities, with our leadership. One of the things that has been asked a couple of times, and I kind of think I know the answer, but I would like to ask it on behalf of a number of our tribes and hear it directly from all of you. So there are a number of projects that are funded under the IIJA. It was obviously from the slides that only like 14 million of the roughly 700 million that you've received just for this last year, I think, is being used. We have communities who are like, you know what, we are a 638 community. We know how to do projects. Why can't we just run with this? You get us the funding, we put it in our bank account so it can actually gain some interest, because now it's sitting in an account somewhere, and we're assuming that there's interest that's being accrued. Hopefully that will go back to the project. But why can't we as a tribe, I'm kind of paraphrasing, but this is along the lines, why can't we as a tribe get the funding that is allocated towards our multi-year projects and administer this and just do the project management with some of the engineering support?
Thank you, Jacqueline, for that question. So yes, this is one of the delivery methods that I had mentioned is a sub-award to a community or a THO to do the work. And so so it is possible. I think with the nice thing about the Indian Health Service funding in the IIJA is that it comes with I'd just say less requirements, but it still has a lot of requirements when it comes to the cost principles and cost allocations and other parts of all the uniform guidance that come with that money. But as far as performing the work, yes, the community can, but we also need to do the due diligence to make sure that we do that assessment to make sure that they'll be successful in that. And we would like to work with them along the way to do that as well. Like I said, we want to make sure when basically our expenses are audited and there's payments to a community, that triggers our whole audit system. And that's, when we have the Office of Inspector General looking at things and audits, we want to make sure that everything is done correctly. And a lot of the rules and regulations, we just have to pass those things down through these subawards to carry out their work. And so if that is the case, we'll work with the community where we can to do that, and we have in the past as well. I'm sorry?
So can you just clarify, because I think that's sort of the crux of it. Would it be like you have the upfront cost and then you draw down from that sub-award, or is it like you have the total amount and you can stick it in your bank account, let it generate some additional interest, and then just do it like that? Or do you have to go back and forth for every time you have an expense?
So that's something, as far as the funding, we have the funding in place, so we don't need to go to the Indian Health Service to seek that funding. Now, there is other funding that's part of these projects as well that we may not have. So there's opportunities to, typically is advance some funding necessary to complete the first pieces of the project and work through that, and that's part of what the agreements can look like as well as part of those sub-award agreements. Thank you.
Thank you in the room. We have time for one more question, and then we are going to invite Natasha Singh back to the stage. Is there anybody that has another question? And this is not your only time to speak with our team from DHE. We do have a table outside that has information that they've spoken about today. And we also have set aside space so that if you'd like to meet on specific questions for your regions or your communities, they will be available for those questions. So we have time for one more from the room. We didn't have any more from online. I'm at the basket. I'm going to keep us on time. I don't see any hands. Thank you, Natasha Singh.
Well, thank you so much.
Thank you so much for that overview. I think that's the third time I've heard the full presentation, and still yet this third time I'm taking notes, and because I know the people in the interior will hold me personally accountable to see that these village projects are implemented on time and their quality, that we ensure that we have local hire, whether it's through, we know we'll get local hire through forced accounts, but for these other ways to contract, we need to ensure that these projects stay on time. I'm from Stevens Village, so this is, as you saw on the map of Alaska, it is also a first service project, so my family will personally hold us accountable as well. I just wanted to share with you a summary and just kind of my takeaways that kind of keep me up at night on these projects. We have, from 2001, 2021, where we kind of locked in the price we thought would be for all these projects. That price has skyrocketed since inflation after COVID by $1 billion, and inflation costs continue. That really makes me nervous about our ability to implement all of these projects. We are going to need to advocate together as a tribal health system to Congress and in the Indian Health Service to ensure that we have enough funding for all of the legacy lists. The high energy costs also make me very nervous. So if we do get the funding for our legacy list, we can't then expect some of our residents to take on the burden of high energy costs for these new systems in their communities. We're working, as you heard David's team say, we're working to reduce those energy costs with our various programs, but that is a concern. I'm also concerned about the statement that we've maxed out the engineers in Alaska. This is going to lengthen those timelines to get our projects in place, and we're gonna have to go probably nation and international wide, but then those engineers aren't exactly used to developing projects in the subarctic and the Arctic. Thank you to David's team for staffing up to manage these new construction contracts. We have staffing issues in DHE. We need engineers, we need construction managers. There's a lot of infrastructure funding across the state in other fields that we're competing with. So that also keeps me up at night. Thank you to all the teams who are working on new ways to contract these projects. You heard about forced account, construction manager at risk, and design build. Those are great ways. We also heard about our ability to subcontract to your regional tribal health organization, to your tribe. Those subcontracts, we've worked out that contract language with IHS, but it still comes with a lot of red tape. The Inspector General are still gonna be using their microscopes to analyze all of our paperwork and our documentation, whether it's a forced account or subcontract, and we have to do all the work to really protect the tribe's THOs and ANTHC with compliance. I'm also concerned about operation and maintenance. Once we get these first service projects up and running, there is not a lot of operation and maintenance funding that we regularly receive from IHS. So keeping these projects sustainable, we're gonna have to put that in our long-term plan. I'm concerned about climate change as well, especially for our 144 communities who are at risk. When you're an at-risk community and you're a first service community, you're gonna face a very difficult decision-making, and that's if your community might move in the next few decades, you're gonna probably, and you're up for a project, that project, either you put it in now at your current location, and then you forego your ability to have a water and sanitation project at your new location. So a lot of planning has to go into those first service projects who are also at risk for climate change. So I think Jacqueline specifically asked about the interest that's accruing on that funding. I think we're gonna look into specifically your question, Jacqueline, because it's a good one. I do know that the Inspector General is also very interested in that interest, the funds that are accruing, and so we'll have to really ensure that everything's in compliance. So we don't have a direct answer for you today, but we're gonna take it back and maybe go straight to IHS and ask the question. Because we don't want to get anyone into trouble, because the Inspector General is going to be our best friend as we implement this new infrastructure funding. So thank you so much to the DHE team. I'm really excited. This is such an exciting time. After all of the advocacy done over decades, we're at this point where we received a huge amount of funding, such a great opportunity to get first service projects. So very exciting time for ANTHC.